Assalamualaikum warahmatullahi wabarakatuh. Good morning viewers. I'm Nabila Devitrianasari from Sriwijaya University. So guys, do you know Covid-19? I think you're familiar with this disease. As far back as the city of Wuhan in China, this new strain has spread around the world, which is responsible for coronavirus 2019 or Covid-19. These conditions, of course, are not to be taken lightly and left in the cold. The World Health Organization has also ruled out the COVID-19 pandemic since March 11, 2020. Actually, what's a pandemic? The pandemic itself is an epidemic that has spread across continents and countries where it has largely affected many people. While the epidemic itself is a term that has been used to know the sudden increase in the number of cases of disease in a particular area population. After all, pandemic terms are not used to indicate the height of a disease, but merely show its prevalence. Let it be known, in the case of the COVID-19 pandemic, it became the first caused by the coronavirus, which has existed since last year. And what about COVID-19 virus in Indonesia? Not only does it harm the health side, but President Joko Widodo also said that the coronavirus affects the economy in Indonesia. Not only does production of goods suffer, but investment also suffer. Here are some effects of the COVID-19 virus in Indonesia. First, some items become expensive and rare to find. Second, Indonesia congregation to depart for Umrah. Third, visits by tourists from around the world in Indonesia drop. Fourth, upset the economic order of Indonesia. Fifth, the import of the goods became impeded. So, how did the public health effort cope with the COVID-19 pandemic? With the growing COVID-19 outbreak in Indonesia, governments, health workers, and communities need to work together to prevent the spread of the coronavirus. Various mitigating strategies of the various factors that can be made are: the first, social distancing; second, restriction on travel out of town or country; third, using social media to educate and promote public health. So guys, health service has been adopted on social media. Health promotion involves information on diseases, how they are spread, clean and healthful living pattern, and how society can play a role in suppressing disease prevalence. The first, you can wash your hand with water and soap running for 40 or 60 seconds. Second, use hand sanitizer with alcohol 70% if water and soap are not available. Third, avoid touching the eyes, nose, and mouth if the hands have not been cleaned. Fourth, maintain a distance between individuals at least 1 meter. Fifth, avoid contact with people who are sick. Sixth, when you are sick, it is best to wear a surgical mask and stay indoors and visit health facility if necessary. Seventh, the ethical of coughing and sneezing, such as covering your mouth with tissue or your sleeve. Eighth, clean and do regular surface disinfection and touches. That was the subject of the COVID-19 pandemic and the public health effort. To prevent the spread of the COVID-19 virus, you should also be alert to hygiene, good health, and remember to keep your mask off when you are outdoors. Okay guys, that's it for me, Nabila Devitrianasari. See you later!